Welcome. My name is Raphael Epstein from the ABC. Before I welcome our guests in these strange times when we do functions, and I don't know where any of you are other than you're likely in Australia and likely in Melbourne and Sydney, I want to thank the traditional owners of the land in this way. I want to mention by name the Boonwurrung and the Wurundjeri people of the Kulin Nation, because I know some of the Melbourne participants are talking to you and meeting with you on their land. And as a way of paying respect to their leaders, past, present and future, I want to mention something you might be able to go and see yourself. It is they think it is the oldest living thing in Melbourne. It's on the corner of Albert Park. It's behind the Junction Oval. And between the Junction Oval and St Kilda Junction, there is one of Melbourne's oldest living things, the Boonwurrung's corroboree tree, the Ngargi tree. They think it's 300 to 500 years old. They are still meeting under that tree to this day. So as a way of paying respect to the land on which we are all sitting and meeting and recognising that they've been sitting and talking on this land and swapping ideas on this land for tens of thousands of years, I invite you all one day, if you go down to a big bash match at the Junction Oval, to go and visit the Ngargi tree. Most people in Melbourne don't even know where it is. It's in St Kilda Junction, and they think it's the oldest living thing close to the centre of the city. I want to also thank everybody for organising this event at the Doherty, Tanya's office and everybody else. And a reminder, the equivalent of a door prize, some of you will win a book. There's a random draw at the end of the evening. But I want to welcome you all for a discussion, a chat, and hopefully some future telling. Tanya Plibersek has edited Upturn, A Better Normal after COVID-19. Tanya is, of course, the Shadow Minister for Education and Training and the ALP MP for the seat of Sydney. We are joined by a few of the contributors to the fantastic book that's just trying to look forward and see what we have or what we will have in this bizarre post-plague year. Professor Sharon Lewin is the inaugural director of the Doherty Institute. She is a consultant, infectious diseases physician, as she reminds me, she's still clinical, renowned for things like her research on HIV. And Professor Paul Torzillo joins us as well. He's the head of respiratory medicine at the Royal Prince Alfred in Sydney and clinical professor of medicine at the University of Sydney. There will be a chance about halfway through for us to read questions off the Q&A, so please feel free to submit them. But let's start with the woman who came up with this idea really early on in the plague. Tanya Plibersek, great to have you here about your book. Why the book? Why did you decide to put this together?
Well, thanks very much for hosting us, Raphael, and thanks so much to Paul and Sharon for joining in. And I want to join you in acknowledging the traditional owners of the land wherever we are. I'm on the land of the Darug people this afternoon. The book really, when we stopped being allowed to go out, I thought it would be a good idea to start a book club with my parliamentary colleagues and read all the non-fiction books I've been meaning to read and get some of the authors to talk to us. And one of the books that we read was Stuart McIntyre's really brilliant history of the road to full employment just after the Second World War, the Full Employment White Paper. And one of the things that Stuart McIntyre was talking about was people had sacrificed so much during the Second World War. The deal with the government was, you've sacrificed so much, we're going to build you a better society after all of this sacrifice. We're going to aim for full employment and we're going to aim for increased home ownership. And I was thinking about COVID-19 and how much we had achieved as Australians. You know, we were disciplined, we were kind, we, for the most part, followed the science, followed the medical advice. And I thought, well, what's the return on that? Because a lot of people had suffered a lot as well. You know, people had lost loved ones, hadn't been able to be by their bedside, hadn't been able to attend the funeral, had lost jobs or had their businesses closed down. What's the better society and what's the better economy that we can deliver after COVID-19 so that having achieved extraordinary things like housing rough sleepers, doubling unemployment benefits, shifting kids to online learning virtually overnight, following the scientific and medical advice, which apparently is really difficult in some other policy areas. Having done all of that, what more can we do? How can we have a better society and economy after? And also I needed something to do on Saturday nights. So I just asked some of the cleverest people I know to give me their views about what a better economy and society after COVID-19 would look like.
And I'm going to ask this question of everyone because I think it's a simple question with a very complicated answer. Tony, do you think we've changed because of the plague, the country and the world?
Yeah, for sure. I think that a lot of things that we just took for granted have been disproved or turned on their heads. And that's both positive and negative. There's a lot of things that we thought were beyond us as a country that we've done. And I think actually the extraordinary job that many places have done in housing rough sleepers is a really good example of that, but it's certainly not the only example of that. Those sorts of things have to be part of our future. We can't do it once for a few weeks and then just say, oh, that's too hard again, because we've proven that we can do it and that not doing it is a choice. So there are good things that should change about us forever. And there's a whole lot of economic assumptions that we made. Like we've got a government that, they had already doubled debt, but, debt was apparently a bad thing. We're now heading to $1.7 trillion worth of debt, and nobody's saying that it's wrong to borrow money. What we're saying is, if we're going to use this money now, it has to benefit future generations. How do we make sure that this spending now has a long-term benefit? So we've turned the debt is bad notion on its head, but the follow-on has to be, what value do we get from this investment that is lasting?
Sharon Lewin, do you think we've changed?
Yeah, I have to agree with Tanya there. I definitely think we have. I'll just talk about some examples, I guess, in health and in public health. So I don't think although people that work in infectious diseases were always concerned about a pandemic, I don't think anyone really believed us that this could happen. And I don't think we ever really thought it would be this significant. So I think our mechanism for being prepared is going to definitely change. I think where we've seen COVID spread, we certainly saw this in Melbourne, and we're seeing this globally amongst vulnerable communities, that you can't have a good health system without health for everyone and good health for everyone. And our even though Australia's dealt with this in many ways by just, by closing our borders and becoming completely isolated from the rest of the world, I think it's a really strong reminder how interconnected our health systems are. And so we can't, even though we have been doing this, we can't just look after Australia. We've got to be thinking about how health is equity in health across the whole world, because otherwise we're all vulnerable to this happening again. So I think there's some of the areas that I think have changed. Then there's so much stuff about how we work and the flexibility in work, the idea that all sorts of people can work from home should they want to, or want a hybrid for working from home. That I think we'll never go back to where we were. And then, in my area, the way we travel and the way we get together and share science, I do really think there's a role for in-person meeting. That I definitely feel the lack of that. But I think there'll be so much more that we'll do on Zoom that we won't go back to, a day in Sydney or something like that.
And I'll come to Paul on whether or not we've changed in a moment, Paul, if it's okay. Sharon, you were one of the people, I guess, informally giving governments advice. Did government, state and federal listen to the science?
My experience was absolutely yes. And actually, I did just read Paul's chapter before coming on, so I think Paul's not going to agree with me as much. But, when you make public health decisions that are affecting the whole country, and you're asking people to do things, Tanya's touched on this before, that they've never done before, that are quite painful, that the evidence is emerging and it's not rock solid. These are really difficult decisions to make. So in some ways, I could be critical that things move slowly at the beginning. But we have to have a reality check here. If we're looking at what the Australian government did, it's extraordinary compared to what many other Western countries did. And yes, they were guided by the science. They trusted the modelling. That was what led to closing our borders on February the 1st to China, which was an incredibly brave decision at the time when really closing borders was unacceptable. Now we take it for granted, but it had never been done before and made a very big difference. I think what we saw in Victoria with trust in the science around getting us, you know, the modelling of how we were going to exit, very, very difficult decisions. There was high engagement around how we would ramp up testing. That was never trivialised from the word go, and I saw many other countries just not really putting in that investment to get testing up high. My experience has been extremely positive in how we've worked together. And there's been times where the path is unclear, and you can see all the experts don't actually know what the pathway forward is. But we've been extraordinarily lucky here on that front.
Paul, I'll get to change, but Sharon thinks you might disagree with it. Do you? Do you think we listened?
Oh, look, I mean, the proof's in the pudding. We've done incredibly well. I think that is a lot to do with closing the borders early, no question. That was the single key decision. And so I think that was good. I think by and large, we've done well. Do I think it's been done perfectly? No. I think that early on, especially, I think governments were slow to act. Already said that. I mean, the international evidence about this pandemic was unequivocal very early on. And although we acted relatively quickly, I think we could have acted earlier. I think that on things that were tricky, sometimes we did well and sometimes we didn't.
Sorry, can you give us an example there, Paul?
Look, I think the whole way the senior bureaucracy and government handled the PPE issue is going to have a lot of consequences. I mean, essentially, they were uncertain about supply. How much were we going to have and how many masks were we going to have and what sort of masks were we going to have? And they took a punt that running a line that there's no evidence that you needed high-level PPE and that we could comply with what were pretty old-fashioned infectious disease guidelines was the way to go. Instead of saying to the frontline health workers, we're doing everything we can to get PPE, but we're concerned about it. So we're not going to give you some line that you're not going to believe about what people don't need to have. I think that led to a pretty early disenchantment on the part of certainly in Sydney, and I think in Melbourne when I talk to colleagues, a lot of people who would have previously trusted their health bureaucracy, I wouldn't put myself in that category, but a lot of other people who did, won't for a long, long time. I think that was a big mistake. I think a lot of other things they did pretty well. The public health response in Sydney was outstanding if you take out one ship. Obviously, Victoria didn't have enough public health resources. They tried pretty hard to fix that and they did. So I think those things are done well. I think in terms of your second question about have we changed, I mean, I think we've seen the best and the worst. I think, I'm not sure if the US has changed, but certainly, we've seen a terribly brutal, reactionary, racist outpouring in the US. I mean, if you look at what happened in the 1950s and 60s in the US, it probably hasn't changed much, but it just got an opportunity to express itself. That's pretty sobering. I think on the other side, many Western governments, including ours, have said that we can't do a lot of stuff about climate change because government can't make major, massive changes that impact on society and industry immediately. And what we've shown is that was bullshit because we've done it like that. So I think this is this will empower the climate change movement. So I think that's a great thing.
Tony, if you don't mind, that's something I wanted to pick up with you. I'm sure some of the stuff, we know some of the stuff Labor was a fan on and an early pusher of, things like a job subsidy. But in terms of the Canberra bubble, if I can ask it that way, do you think both sides now think that governments have more ability to intervene and act? Do you think that's a given?
I think Labor always supported Keynesian economic policies, and the proof of that during the global financial crisis was, you know, very significant investment in things like social housing and upgrading schools and all the rest of it. And there were a lot of people on the conservative side of politics who thought that was an unnecessary indulgence. I think they've come closer to us on some of the economic approaches. I think there's still people in the Liberal Party who think that both the economic approach and even the science, you know, being guided by the science when it comes to the medical response is, you know, they know better than the doctors. I've still got colleagues who are out there spruiking hydroxychloroquine and, you know, vaccine scepticism and all sorts of nutty stuff like that. So it's not a universal move to embrace, you know, stimulatory economic policies and science-based approach to health, but there is more of it than there used to be.
I want to know, though, if you think, because very optimistic book, it's just really interesting reading it in Melbourne, because we all still feel like we've got PTSD and we still feel very punch drunk and like it sort of emotionally and psychologically scarred. And this sounds like a small p political point, but it isn't, because I think it's about the future. At the worst of it, there were two significant cabinet ministers willing to have a go at the Victorian government about the approach. Now, sort of putting that argument, who was right or wrong, aside, is that a cause for pessimism? Is that like, you know, when we come to some sort of crunch point, are we actually going to be better and different? Or is that proof that actually the old stuff's still there and the old responses still kick in?
I think asking a general question like that, Raph, is a bit like asking, is media good? Because of course there are people who are passionately committed to rebuilding a better society, an economy that delivers jobs with decent paying conditions, secure jobs with decent paying conditions. There's that. And then there's a bunch of people who will be cynical assholes any opportunity they get, because that's kind of their DNA. So I'd say that there is much less tolerance from the public of that sort of cynicism and division and trying to rile it up. So whether things change for a day, whether they change permanently, that depends a lot on the electorate, doesn't it? I mean, we live in a democracy. If people reward bad behaviour and cynicism in politics, then it'll keep happening. If people reward cooperation and thoughtfulness, maybe we'll get a bit more of that.
We can come back to these things if people wish. I'll keep an eye on the Q&A chat, and I can see people already asking things about climate change, that sort of thing. But Sharon, one of the things you mentioned in your chapter was, I guess, whether or not we're doing enough globally. Actually, there's three separate things. Firstly, you mentioned sort of looking after other people. The number in your chapter that really stunned me, Remdesivir, which is produced by, is it Gilead, I think, or is that the company? A treatment costs $4,600, but it cost them like $8 to make it, which has obviously been a huge issue for you coming from an HIV background. Has that changed much? Are you seeing that actually there's going to be a more equitable access to crucial treatments and vaccines?
Well, we're seeing it now with the vaccine. So, you know, the Pfizer vaccine in the US is going to be made available free. And that, you know, It depends on how the drugs or vaccines are developed, of course. And in the HIV story, and again in hepatitis C story, it took about 10 years to alter drug pricing so that drugs could be available. There was a two-tier pricing system so that we pay something different to what a low-income country pays, and that was the only way that you could get uptake. What I think, the fact that remdesivir wasn't widely available was heavily influenced by the fact that this was under Trump's leadership, who very quickly said, this is, wanted to buy all the drug supply for the US. So we were very, I think a lot of the issues around global cooperation have been very skewed, unfortunately, because of the current American administration, which was very much against sort of the usual leadership that we've seen from the US. Is remdesivir now widely available? No. Is a generic formulation, widely available? No. Do we really need it? It's not a wonder drug, that's for sure. But if we have a wonder drug, we really do want to make sure it's available widely. The other big initiative, I think what we've seen with vaccines is a bit worrying to me. Something like 50% of the world's vaccines have been bought by 13% of the population, which is basically high-income countries. And as you can see that now, Australia is very rapidly buying enough vaccines so everyone can get vaccinated. But it is also supporting an effort such as COVAX, which will allow global access. And I think those entities, they're being built on the run here, and we've got to make sure that that sort of infrastructure around access is, rock solid, and the rules are all there pre-pandemic. We're designing it on the run at the moment. It'll be very interesting to see what the US government will do about COVAX once the administration changes. And just very briefly, COVAX is an entity where over 70 countries have contributed various vaccines as a source, which means you've got the power of large volume and then distributed to the places that need it most. So we just have to be supporting things like that, because if we don't reduce this globally, we will not have the freedoms that we enjoy, and it's the right thing to do. So I don't think we've worked out and one area that I think we've done not as well on now 10 months into the pandemic is on developments of treatment. We weren't as well prepared for antiviral drug development. We didn't have those public-private partnerships in place that we've had in vaccine development, and we still don't have very good treatments for COVID.
So what if you had the ear, let's just say, of a shadow minister or even a health minister, let's just say, for example, like what's the one thing Australia could do? Because you write a fair bit about, the structures we've got aren't quite enough for vaccines and treatments. Is there one thing Australia can do to help with that or make a difference?
Oh, absolutely. I think there's a lot of, what the Australian government, most governments are looking, of course, in their own borders, how prepared are we and how to make sure things won't be like this again next time. And then, of course, at the same time, thinking more broadly. But I will just say that that long-term investment in science in Australia is really, really important. So, the UQ vaccine unfortunately didn't materialise, but we were in the front run. We were in the front of the pack to get a vaccine because of the blue sky discovery work that's been done in virology up in Queensland. So I think that, the fact that we isolated the virus from the first case that landed on our shores, and no other country had yet isolated the virus, but at the end of January, is because we've got skilled virologists. So you just need that workforce. You cannot create it overnight. So if I had the ear of the minister, I'd say we cannot take that for granted. We have to make sure we've got a workforce ready and skilled. And I do think we need capabilities to make drugs and vaccines in a country like Australia, not just for us, but also we could play a very key role in the region in that front.
Paul, if I can ask you something that you wrote, because again, this is a detailed question in some ways, but when we say, are the politicians listening to the science? You wrote, I'm not actually sure what you were referring to, but there's a headline, beware the politicisation of the bureaucracy. Advice of senior health bureaucrats was always more conservative than that provided by non-aligned experts. I just wondered what you were referring to. You might not remember.
in your chapter what you were referring to. But whether or not politicians listen to science is often a day-by-day thing, not a broad thing. What did you mean by that?
Oh, look, firstly, everything that Sharon says about having the ear of someone and pushing the fact that we need long-term investment, sustained investment in scientific resource, I heartily endorse, and I think everybody would in the sector. I mean, what I meant by that is, I think politicisation of the bureaucracy is not a new thing anywhere, certainly not in Australia. And I think that on the one hand, as I said, having senior public health bureaucrats standing next to ministers and the Prime Minister gave the impression that they were listening to public health advice. On the other hand, I think there are many times when those senior public health bureaucrats knew what sort of advice was going to get over the line and what wasn't, and they would, and at least at the public level, were modifying it. I've had a couple of senior people say to me 6 months ago, well, we've got to get the economy going, of course. Well, where did that come from? From a public health person? I mean, that comes across the table, I think. So, yeah, I've got a general concern about that I think especially people employed in the bureaucracy can modify the advice they give on the basis of what they think is going to get over the line. And so it tends to be conservative. And I think that some of the more radical proposals from outside the sector were actually leading the charge. I mean, I think, I think especially early on, the most important figure in the health sector was Norman Swan, who was not modifying what he thought was going on, what he was saying.
Well, can I ask you about presentation? Although I'd throw in there, I think Brett Sutton using the word pandemic helped Scott Morrison use it before anyone else did. But that aside, the presentation of the science, I was quite critical actually that someone like the Emergency Management Commissioner, Andrew Crisp, or Brett Sutton wasn't. I thought they should have been the person doing the daily update, this number of cases, this number of tests, etc. But we didn't get that because the politicians feel that they are the people who are accountable. Climate change is the same. Our politicians don't want to contract that out. I just wonder if you've learned, or if you think we've changed, who's really the person that we listen to. It's easy to say listen to the science, but you can't vote Brendan Murphy and Paul Kelly out. You can vote Scott Morris. Same with Brett Sutton and Dan Andrews. Who should be the person presenting the policy based on the science? And is that going to change because of what we went through?
I doubt it, and I'm not sure of the answer to the question.
Great, me neither. Sharon or Tony, because that seems to me because I can see on the chat already, and everyone uses the climate change example. I use the climate change example glibly all the time. Have we learned more about, who's responsible for making the hard calls, the scientists or the politicians? I'll start with you, Tanya.
I think the real danger, Raf, is that people decide that selectively depending on the circumstances. So if you've got bad news, you send out the scientist, and if you've got good news that you want to take credit for, you go out and do it yourself. I think, I think it's very important for members of Parliament who are accountable in a Westminster system of democracy to genuinely be accountable. And that means if you are making the calls, if you're making the calls about closing borders, if you're making the calls about sending kids home from school, if you're making those calls, you've got to be the one fronting it and fronting up when it goes wrong as well as when it goes right.
Sharon?
I think it works if it's a true partnership. So I don't have a problem at all with politicians standing up there talking about R0s. I loved it. I thought it's fantastic that Scott Morrison knows what an R0 is, and that politicians they're probably tighter, punchier communicators than us, more kind of, we don't really know. And
yes.
I think the fact that they felt confident enough to stand up and defend it, and it got well versed in the issues, brilliantly well versed. I've no problem with that. And I think it has to be a complete partnership. So without that political leadership, scientists can be seen sometimes out of touch and not knowing how the best way to communicate. There are big decisions here that were not just health decisions. They had big implications.
Yeah.
One of the best things we did in Melbourne along with other things there are multiple. One of the best things was, paid pandemic leave, and which, was the source of, we understood this from the research of who was going out, when they were positive and why would they go out, because they have to work. But it's the politicians that can make the decision on paid pandemic leave. So I think it's a partnership, and you've got to have that strong political leadership, full understanding of the science, constant dialogue with scientists, and as well as community. I think we brought in community a bit too late, to be honest, because it was in a public health emergency, it's all top down and rule driven, and we had fines for all sorts of things that are generally not good for public health, which you want it to be community led. So it is really hard to do this in an emergency, but we were a bit slow, and that was a problem in Victoria.
There's a few things in both of your chapters that I want to come to, but I want to invite people on the in the Q&A function, if they wish to put a question there. I'm just going to use this forum to actually communicate with Rebecca. I've only actually got one question there, and I know there are more, but I will ask that one because I know a whole lot of people had it. But keep contributing your typed questions in the Q&A column, and I'll come to that. And I want to see as well if we can come back to Sharon's, because she mentioned whether or not pandemics are going to become part of our national security. So I want to come back to that. But this is a question from someone, Catherine, I think it's Satsky, which is my question as well, to be honest. What do you think the pandemic response means for climate change? As Paul says, we've shown major change can happen very quickly. On the other hand, people are exhausted with all the change and adaptation they have taken on. I might start with you, Tanya, because I reckon America's the counterexample, isn't it? They don't believe the virus is real while they're dying. Has it changed the climate change approach, the pandemic?
I think what you say about people being exhausted, I heard someone describe the year 2020 as a dustbin fire of a year, and it really struck a chord with me. I do think people feel exhausted by the sacrifices they've made and the discipline they've had to show, and I think they're very worried about their work, the permanence of their work, whether they're going to see a pay rise anytime soon, whether their kids are going to leave high school or TAFE or uni and be able to get a job. So I think when we talk about following the evidence and accepting that we need a climate change and energy policy that reduces pollution and reduces power prices because renewables are cheaper, we need to be very careful not to make this or not to get sucked into the jobs versus environment debate. And the people who are determined not to act on climate change are trying to make this a jobs versus environment debate. And when people are tired and worried, if you say that you're taking something away from them, you're taking job security away from them to act on the climate, I think that's a very dangerous
Can I interrupt, Tanya? Do you think, because it was often a dichotomy, or it was binary, wasn't it? It was the economy or our health. I just wonder if that debate that was really furious, especially in Melbourne, but not only in Melbourne, because those concerns about climate, I guess you've always had that challenge. You don't want it to be their job or the environment. Has the emergence of that debate during the pandemic, has it changed the way you see that climate change difficulty?
I think that we absolutely proved that good health policy is good economic policy. And you only need to compare the Australian outcomes with the rest of the world to see that the best thing you can do to run a strong economy is keep people healthy and safe. So I think it's absolutely possible to reassure people that we're not in a climate versus jobs environment, but it takes reassurance and it takes pushback on that argument.
Sharon, do you want to add to that? I've got clinical trial questions, but Sharon or Paul, do you, that
the opposition between health and jobs, is that the same when it comes to environment versus the economy with climate change? And has it changed the climate change debate? Sharon?
Well, it's been so, such a positive seeing the response of policy to science in this crisis, but it was so immediate, and the consequences were so huge and so present that that's the problem with climate science and pushing politicians to respond. It doesn't have that urgency. We need to work out how you communicate that. Then health, we had it was the fact there was no choice, and it was so immediate and so present. So that's still going to be the challenge. It's not even around science skeptics, and as we just heard from Tanya, this issue about really wanting economic security and that sort of slightly less tangible consequence of global warming. But we have to change it.
Might be a media thing. I mean, if we've got coastal erosion and fires and that doesn't feel immediate, maybe that's a media problem. But
yeah,
Paul,
in fact, it felt almost like we were going to see a big change after the fires, to be honest. That was probably going to be the turning point, and then that got rapidly lost in the pandemic.
Paul, you want to add anything to that?
Yeah, I agree with what Sharon and Tanya both said. I mean, I think climate activism absolutely necessitates arguing against that dichotomy that it's either jobs or the environment. We've got to find a way to do that. I mean, I think climate change, it's sort of got two issues here. The first is, and I think Sharon pointed this out in her chapter, I mean, climate change has a direct impact on animal species location and migration. That has a direct impact on transmission of viruses and other infections from animals to humans, and we're going to face more of this. And so climate change is a driver of the problem we've just had. And in addition, I mean, I think it does show that governments can take actions to look after the population, which are dramatic if they get pushed into it. Climate change is dramatic. It's just that, as Sharon says, it's hard for us to demonstrate that.
Okay, there's a question here. It was disappointing to see the fragmented Australian response re clinical trials, where numerous small trials were funded but underpowered and yielded no results. What do panellists think about the possibility of centrally, perhaps NHMRC coordinated national trials, like the UK has done via the NHS? Or are Australian researchers and doctors too concerned about their own personal fiefdoms? I'll go straight to Sharon with that one.
I fully agree with the person that asked that question, but we can control this. Clinical trials in Australia were driven by funding opportunities, which are great. We had the MRFF do a number of calls around treatment trials. Fantastic, you could mobilise money quickly. We've never been able to do that through NHMRC, much harder. But the funding model, encouraged fragmentation. So you could get, groups of 10 together. Well, in fact, had we had a driver saying, create a consortium and we'll give you $30 million, that's how we would have got a single trial. Added to that in the UK, which is probably the biggest success story on clinical trials, because most of the country got behind a single trial called Recovery, which enrolled people at record speed and eventually proved that dexamethasone works, which was a fantastic advance. The Chief Health Officer in the UK has the sort of pandemic powers to mandate this sort of thing. And I think we should be doing things like that in an emergency, because people's natural tendency, actually, it's not all driven by personal fiefdom. I think my experience was that, because COVID touched every single discipline and every doctor and researcher's lives, that most people really were passionate about wanting to make some sort of contribution. So when they had COVID in their own hospitals, they were all driven to wanting to find solutions. So I don't think it was an evil driver for fragmentation, but the funding model drove that. And you do need that sort of leadership in a crisis to say, look, we're going to do, we'll do 2 trials across the country. And we never heard that. We never thought about doing that. And I think it's something we should think about very seriously.
Paul, or I'll come to you as well, Tony, but Paul, the trials, could we have done that better?
Oh yeah, way too many trials that we're never going to have the numbers to, the power to answer a question. There's a bit of truth in everything it said. A bit of this is ego driven. A lot of it is what Sharon said, people wanting to make a contribution. We were never going to have the numbers to do, big, large clinical trials of treatments. I don't think, a good thing that we didn't, but there's other more innovative ways we could have contributed. And I think she's completely right. If you were going to run this, it'd be, a single driver, a large consortium. I'd agree with what she said.
Tony, if you've got something to add to that, otherwise I've got a question about essential jobs that would be good to kick off with you, but I don't know if the trials is your wheelhouse.
No, these two are the experts.
Okay.
Well, actually, intensive care did quite well, didn't they, Paul? I mean, intensive care, you are pretty linked up around the country. You had a single trial that was pre-approved, REMAP cap, and, you didn't enroll a lot of patients, so we didn't have... Anyway, I think intensive care...
Yeah, I think that, they did make a good contribution to that trial. There's a couple of good examples, but I think, as you said, there are a lot of people with small groups who had a big idea, but we're never going to have the numbers to do it. Yeah, I mean, we're still early in this thing. A lot of the conversations as if we're through COVID and out the other side. We had a new case in Sydney this morning, of course, with a whole lot of implications. So we're going well so far is probably what we should say.
Well, there you go. My emergency medicine father always said the intensivists are the only other doctors worth listening to. So yet again, my father is right, which is the lesson I learn every day. This is a question, really, I'll start with you, Tanya. Do you believe the pandemic will permanently change society's perception of which jobs are considered most essential, given the restrictions reflected the perceived importance of certain workers, e.g. health workers above others? Also, Ms. Flippersek, what a lovely photo of the Honourable Paul Keating MP in your office. But also, is it going to change the way we perceive which jobs are essential?
I think it has changed the way we perceive which jobs are essential. So obviously, health workers, anybody who's caring profession, aged care, childcare, disability support, but also the farmers that grow our food, the truck drivers that brought it to our cities, the supermarket workers that stacked the shelves and turned up day after day to sell stuff to people. Sadly, I think that work, that essential work, is not being really repaid by an industrial relations system that rewards the nature of the work as essential. We are nevertheless, I don't want to have a party political spray about the new IR proposals, but if someone's an essential worker, don't they deserve a permanent job with a reasonable rate of pay that increases over time? And haven't we learned, or shouldn't we have learned, that insecure work, where people are working multiple jobs in multiple venues, where they don't have the ability to take time off if they're sick, that's not just bad for individuals, it's bad for all of us. In fact, it was one of the greatest dangers during this period. So the difference between how people feel about the people who looked after us and the way our laws reflect and our pay rates reflect the importance of that work is there's still quite a gap there.
Can I just follow up on that, Tony? Because, I mean, Victoria's aged care is going back to the same thing. We've now got that funding pool that was supposed to keep people mainly in one aged care facility. That's gone. That's stopped. I mean, so I hope you are right, excuse me, when you say essential work's been reframed, but the conditions haven't. We've gone back to the same, both health risk and secure work risk.
It's a really serious problem, and it's a problem for individuals. It's a health problem, and frankly, it's a macroeconomic problem as well, because what do we need in the economy right now? Confidence and demand. We need people who know that they'll have a job next month and next year, so that they don't mind buying a cup of coffee on the way to work, because they're not saving every penny for a day when they're not going to have any income. So at every level, our employment relationships should be better responding to the work that is essential. And we learnt that truck drivers and childcare workers who are on starting salaries of $21 an hour, and people who are working in disability support services, again, earning 20-something dollars an hour, are underpaid and undervalued, and their insecurity is a problem that all of us should be striving to fix.
Sharon or Paul, I don't know if you've got something to add to that, but there's a few, third wave questions. I can't see you both jumping out of the box there. So, because Paul, you mentioned we might not be out of this yet. So I'll put this to you first and then Sharon. How prepared are we for a third wave? And what do you anticipate the public response will be to a further lockdown? I think Germany is the latest example I read about where fatigues led them to a real problem. How prepared are we for a third wave, Paul?
Look, I don't really know the answer to that. I think a third wave would be tougher. I mean, I think and I hope that what we'll probably see is small cases occurring, and in most places we'll have a sufficient public health and hospital capacity to manage that and keep the numbers low. I think that as long as we've got people coming back to Australia, and I think they're absolutely entitled to do that, and you know, that's going to occur for another 6 months at least, and then we'll be having other people coming and going. As long as we've got that, really we're going to have a risk of having a small number of cases, and I think if we can stay on top of that, that's how things are going to run. The difficulty is that dealing with a very small number of cases, if you want to do that really competently and really well, you sort of can't cut down your human resource, effort, infrastructure resource compared to whether you've got 5 times that number. You sort of need the same thing. You know, if you're going to have people adequately quarantined, you've got to have hotels that are dedicated. You've got to have a whole lot of staff in there. You've got to continue to manage them and supervise them. You've got to have access to isolated, quarantined, well-managed staff areas in public hospitals. We've got a lot of old hospitals in Australia. A lot of our teaching hospitals are old. They're not set up for this sort of stuff very well. So instead of being able to quickly grab 10 single rooms, you've got to grab 2 wards. Even with small numbers, we're going to have to sort of keep doing that a bit for quite a while. And that's going to be tough for the health sector, really, but it's going to be necessary.
Sharon, are we ready for a third wave and a potential, what would happen with the next lockdown?
I think it's very likely we'll have more cases. I think it's very unlikely we'll lock down. And so people need, as Paul said, that the major vulnerability is hotel quarantine and return travellers. But we've got, you know, systems have been set up in place, but even with the best systems, these things happen. And we've seen what happened in Adelaide and Sydney, and it was very quickly detected and squashed. And what I hope we don't see is that if we just have a small outbreak with 10, 20, 30 cases, that we don't close the whole country down again and close down borders. But I think we need to be prepared that we will see intermittent leaks from quarantine. Even if we put in brilliant systems, it's not, you know, it's not bulletproof, and we may well see it. And we just, the most important thing is to keep it high on the agenda. You know, the fact that that young doctor thought about testing that woman for coronavirus in Adelaide, that is, you know, a few days later with that woman on the ward, they would have been in a very different situation. So high awareness. And of course, we're going to have a vaccine in March. You know, the vaccines, it's a whole other discussion, but and we're in summer, which is also all good for us.
Well, that's the major thing it's going to save us, isn't it? Being in summer.
No, the major thing it's going to save us is continuing to test and very good contact tracing systems, and not jumping to clock down our borders the minute we get 1 or 2 or 4, 3 or 4 or 10 cases.
Yes. Look, I'll come to any more questions on the Q&A if people wish to post them, but I wanted to finish by asking you all this question. I've said quite a few times that the plague is like a deep, dark, truthful mirror. It shows us who we are. It shows us who our society is or what it is. And I am distinctly unimpressed with my profession
I could fill books if I had the time to write them about how poorly I think the media did, especially in my city. But if I could ask the three of you, and I might start with you, Tanya, if there's one thing you learnt about the country, maybe about yourself, about an institution, maybe something you had always thought, maybe something you'd never suspected. I just wonder, Tanya, if you can narrow down to one thing you really learnt from the tough year we've all had.
We can be better than we can be better than we think. Not we always are, but we can be.
Did you always believe that?
Yeah, no, you're actually getting me to confess that I've always been a bit of an optimist. Yeah, but I sometimes felt like I was the only one who felt that. So what I've seen is just an extraordinary outpouring of kindness and discipline. And there were terrible people. There were the people who were, fighting over toilet rolls, and there were the people who were showing off, videoing themselves arguing with 19-year-olds in Bunnings about whether they had to wear a mask or not. There was some really examples of very bad behaviour, but there was so much generosity. Neighbours looking out for neighbours, people thinking my, business down the road that I love is struggling. I'm going to go and spend some money with them. I don't really need this stuff, but I'm going to go and get, the takeaway food that I could make myself at home. But there was just, people wanted to look after each other, and I was so pleased to see that. That was great. That part of it was great.
Sharon, what did you see when you looked in the deep, dark, truthful mirror?
Well, in Australia, I really agree with Tanya about that that real community spirit and willingness to sacrifice something for something bigger than their own health. And when you look around the world, you just do not see that around in many other countries. So I think that fact that people were willing, I think that there was mistrust at times, but largely there was trust in government, there was trust in the science, there was trust in the policy largely, and people gave these sacrifices. And I think the other thing is that all of us have gone through this experience of our whole kind of world's kind of closing down, and a reflection on not taking for granted what we had before. So I think that's been kind of important for everyone.
Cool. Is there one thing you saw or learned?
Two things. I mean, I agree with Sharon and Tanya, and I've met quite a few Josephine punter in the street who's lost their job or their income threatened, and still say, I think we should be doing these things. I support what's going on. That's incredibly admirable. The second thing is that, I have been incredibly lucky to have an incredibly interesting job and some work with some great people. This year has I have had some colleagues that I work with, doctors, nurses, porters, security people, who are so overwhelmingly impressive in what they do every day. I genuinely mean this. It brings me to tears. So that's been, incredibly rewarding, and I feel really lucky to have worked in that environment.
Are you feeling optimistic about the future, Paul?
Yeah, I'm on the Tanya team of optimists by and large. Yeah.
He just hides it well.
He needs a job in journalism. Sharon, are you an optimist at the end of this? Are you feeling optimistic or pessimistic?
I think we've got a way to go globally. I'm feeling very optimistic about Australia, but the situation in the US, Northern Europe, I just was hearing about Uganda, for example, now that in hospitals about 30% of people are positive. And we haven't heard much about what's going on in Africa. I think we've got a long, tough road as a global community with COVID still. And although vaccines will be rolled out, there will be a lot of complexities around it. So yes, I am an optimist, but that's my natural disposition. But I think with COVID, Australia's in a very special place. But I'm really acutely aware that this is just another universe to what many of our friends internationally are experiencing. And I think we're going to see some very dark times actually for Europe and the US.
Tanya, with the globe in mind, but I guess with a focus on us, you are still an optimist. That's a given.
Yeah. Yeah.
Sure.
Look, my faith in people is challenged, but never really defeated.
Okay, good. You too could get a job in journalism. Stay where you are. Don't go anywhere. Upturn, a better normal after COVID-19. What did I read? I read Camus' book. I read The Short History of Plagues. I have read so many books about the plague this year. This is easily the most optimistic one because all the others were written with a historical perspective. Don't forget, all of the proceeds go to Reverend Cruz and the Wayside Chapel in the heart of Tanya's seat. We have some book prize winners, so sadly you don't get the joy of reaching under your chair, but the Doherty Institute team will be in touch with these people to make sure you can claim a prize. Adrian Clark, Andrea Liang, Cindy Ferguson and Min Chong. Thanks so much to everybody who registered and listened. A huge thank you to everybody at the Doherty and at Tanya's office as well. Tanya, good on you for getting onto this early because we're going to need a lot more thinking like this. Sharon was the person they all called and said, are we doing the right thing? So a huge thank you to Sharon. And I haven't known Paul before this, but I've spoken to heaps of people in the medical community, and the medicos did much better than the media in this year. But that's okay. That's probably standard practice as well. Thanks for everybody for participating. Thanks to the PR team as well. Have a fantastic Christmas and New Year. And here's to no more virus and a virus-free Australia and a rapid rollout of the vaccine. Have a great evening, everybody.